Did you know that your feet can reveal a lot about your health, even before you feel any problems? Many people only pay attention to their heart, liver, or brain, but forget that their feet are a very clear indicator of systemic disorders. Your feet can signal circulatory, neurological, musculoskeletal disorders, and even dangerous diseases silently developing inside your body. But have you ever felt numbness, swollen ankles, or changes in skin color but thought it was just normal fatigue? The truth is, these can be early warnings of diabetes, cardiovascular disease, varicose veins, anemia, or nerve damage. In today's video, we'll explore 12 warning signs in your feet that you should never ignore. Recognizing them early can avoid dangerous complications. Watch until the end, because the last sign is one that many people experience but rarely realize is related to a serious health problem. The first sign is numbness or tingling. If this occurs frequently or spreads to the ankles, it could be a sign of nerve damage. Common causes include diabetes affecting peripheral nerves, vitamin B12 deficiency, circulatory disorders or nerve compression. Sugar, alcohol, and too much caffeine can all deplete vitamin B1 and weaken your nerves over time. However, you can use benotamine to penetrate those nerves and help repair them from the inside. The second sign is swelling. If it persists, it could be a sign of a heart, kidney, or venous system problem. When the heart doesn't pump efficiently, fluid can accumulate in the lower extremities. This also affects people with varicose veins. The third sign is persistent heel or sole pain. If pain appears as soon as you get out of bed, it's a typical sign of plantar fasciitis. Another thing to watch for is discoloration on the lower leg and top of the foot, appearing as red or brown patches. This indicates circulatory problems. You need diosmin and hesperodin, natural flavonoids in vitamin C, to help strengthen vein health. Increased movement and exercise can help muscles push fluid out, along with potassium and magnesium in your diet to restore balance. Another sign is deep cracked heels, where the skin looks thick or calloused. This often stems from a lack of vitamin B2, B3, or saturated fats. Applying a thick layer of lanolin wax at night is actually the best natural way to repair these deep cracks and restore the protective barrier. Another sign of your internal health is your toes turning white or blue. You might notice that the tips of your toes, or even your fingers, start turning blue or white when it's cold. This is a sign of an overactive fight or flight response. This causes the small arteries in your toes to constrict excessively, meaning there isn't enough blood or oxygen reaching those areas. You should use magnesium glycinate for at least 2 to 3 months to help relax those arteries and restore blood circulation. Or, for a stronger treatment, you could look into hexanicotinate. This is a similar problem to getting leg cramps at night. When you're magnesium deficient, too much calcium goes into the nerves and muscles, causing them to constrict violently, resulting in painful cramps. Magnesium glycinate is the best form for relaxing muscles. along with drinking 1.5 liters of water daily with sea salt to hydrate. And then there's the big toe pain. This is called gout, where you experience intense, sharp pain in the big toe. One of the main causes of gout is dehydration. When the kidneys are dehydrated, they can't filter uric acid properly. The uric acid starts to crystallize and deposit in the big toe joint. Drink 2.5 liters of water and avoid alcohol and sugar. Now, another internal signal is a deep itch. It's an intense, uncomfortable itch deep within the skin, and scratching usually doesn't help. This occurs when the gallbladder is blocked or the liver contains too much fat. Bile acids build up and deposit under the skin. Many people use milk thistle to thin bile. I also recommend paying attention to hair loss on your toes. Hairy toes are healthy toes, but if the hair starts to disappear, it could indicate poor blood circulation in the feet. The hair follicles aren't getting the oxygen they need. This is a typical sign used to identify peripheral artery disease. But don't worry, we can improve blood circulation naturally, and I'll talk more about this in a moment. Another sign is foot deformity or weakening. If you notice feet changing shape or difficulty balancing, it could be nerve damage. In people with long-standing diabetes, damaged nerves can alter the structure of the foot without the patient realizing it. The 10th sign is slow healing wounds on the feet. A minor scrape that lasts for weeks is a serious warning sign. This is often an early sign of diabetes. When blood doesn't circulate well, the body can't supply enough nutrients to heal. The 11th sign is consistently cold feet. If your feet are colder than other parts of your body, it could be poor circulation. This is common in hypothyroidism or anemia. The body prioritizes vital organs, leaving the feet cold. The 12th sign is thick, discolored, or brittle toenails. Toenails can reflect your internal health condition. Pale or bluish-purple nails may relate to anemia or lung problems. Brittle nails can be a sign of thyroid disorder. Supplement iodine naturally by eating seaweed or other sea vegetables a few times a week to support your thyroid. The 13th sign is pain when walking that subsides with rest. This is a typical sign of peripheral artery disease. When you walk, muscles need more blood, but narrowed arteries cannot supply enough, causing pain. When you rest, it disappears. The 14th sign is prominent or tortuous varicose veins. These can cause pain, heaviness, and swelling in the legs. When venous valves function poorly, blood pools in the legs, causing the veins to swell under the skin. The 15th sign, and most overlooked, is loss of sensation. When you can no longer feel heat or cold in your legs. This is dangerous because you could be injured without knowing it, leading to infection or serious complications. This is why doctors always recommend that people at high risk have their feet checked regularly. Let's start improving foot health by improving the 3 systems that control foot health. We'll begin by improving blood circulation in the legs and feet in a very simple way by increasing blood flow. Add more potassium and magnesium to your diet by eating avocados, leafy green vegetables, pumpkin seeds, and cooked vegetables. Make sure you drink at least 1.5 liters of water a day to keep your kidneys, liver, and other organs hydrated. This will protect your feet from toxins and uric acid. You should also try to walk at least 10,000 steps a day. Walking activates the muscles in the shins, helping to push out excess water and helping blood flow back to the heart. Next, we need to improve nerve health, which actually nourishes the nerves in the toes and feet. You see, the nerves in the feet are the most vulnerable because they are furthest from the heart. Therefore, start consuming foods rich in vitamin B1, such as nutritional yeast, eggs, sunflower seeds, and organic pork. Or you can take a specialized vitamin B1 supplement called benotamine. This will help reverse nerve damage. Some choose magnesium glycinate supplements to stabilize nerve signals in the toes and prevent cramps. Make sure the brand you choose is high quality with at least 400 milligrams of elemental magnesium per day. And don't forget to avoid alcohol, sugar, and refined flour, as these deplete vitamin B1 and harm the nerves. Keep this in mind, especially if you have diabetes, as these can increase the risk of tissue necrosis. And finally, we want to improve the structure of the skin and toenails. Ensure you're getting enough zinc, selenium, iodine, and trace minerals by eating seafood about 3 times a week. Include shellfish, mussels, clams, shrimp, wild salmon, sardines, dried seaweed, or kelp. I also recommend regularly eating fresh, uncoated butter. This type of butter is rich in beneficial fats and vitamin A. You can also apply lanolin or beef fat to your legs to nourish the skin if it's dry. Eat vitamin C-rich foods like berries, citrus, and sauerkraut to help regenerate collagen in the skin and vessels. By improving these 3 pillars, circulation, nerve health, and skin nutrition, the root causes of many leg problems will be addressed. Your feet work every day to support your entire body, and they're often the first place to show warning signs. Small changes like numbness, swelling, pain, or coldness may be early indicators of serious conditions. The important thing isn't to worry excessively, but to listen to your body and get checked promptly. Early detection always makes treatment easier, safer, and more effective. Observe your body daily, pay attention to small changes, and consult a healthcare professional when necessary. If you found this helpful, please like and share it so more people can recognize early warning signs. Subscribe to Vitality Daily Dose and turn on notifications for more health and nutrition tips. Thank you for watching, and see you in the next video.